My name is Seth Deja and dental specialist in pediatric dentistry. One of the reasons that I got involved in pediatric dentistry is I have my own family and my own kids. I love the enthusiasm and the energy that they bring to the office. I also love the challenge of showing them that, seemingly difficult parts of the appointment are really easy if you just find someone who will take the time to explain everything and listen to your needs. Dental cavities are pretty common, and some of the factors that influence them can be biological, they can be environmental, and they can be the protective factors or lack of protective factors that we have. So, one of the main ways to prevent them is one, by establishing a very strong oral hygiene regimen that includes brushing twice a day and making sure that we're doing good quality flossing. On the other side of it, from the environmental aspect, is you want to be careful about the frequency that we're having snacks. The AAPD says that anything greater than 3 times a day as far as snacking automatically puts the patient into the category of high risk for developing cavities. If a parent is brushing their child's teeth and notices something that just doesn't look right and they think that it's a cavity, one of the best things to do is just call a pediatric dentist and come into their office, because not always is what we find or see as a parent is actually a cavity. There can be things like staining, certain bacteria that may throw a parent off, but in fact, it's something that's just a normal part of the mouth and that requires no treatment at all. Baby teeth can affect long term dental health. Number one, it's great to establish the oral hygiene habits very early, but premature loss of a baby tooth can affect the position that the permanent teeth come in, as well as one of the most obvious things is that if you have a large cavity and it goes untreated for some time, it can lead to a dental infection and often pain or discomfort for the patient. One of the main ways to make the experience at a dental office positive, especially if you do have a cavity, is to show them that it's not a big deal. And also that if you do get a cavity, it's not a hard thing to fix. As long as you're working with a professional that listens to to your needs, takes the time to get to know you, and explains all the different aspects of the appointment and breaks it down into very short and doable treatments. I think that that's one of the most effective things for a patient to be able to get the treatment done. One of the best skills that a pediatric dentist has is to be able to look at the patient, look at their biological age, and then look at their dental age so that they can determine what treatment is necessary. Just because you have a cavity doesn't mean it has to be treated. They have very atraumatic procedures that you can do where you can put medicine or medicament on the tooth. But very often, if the patient's having no issues and they're getting to the age where the tooth is going to exfoliate, you can often just monitor that tooth, work on your oral hygiene, and allow it to exfoliate normally. And during that time, what you're doing is establishing a great oral hygiene regimen whenever the patient transitions into permanent dentition. One of the best tips for preventing cavities that someone can do at home is being careful of what we're putting into our pantry, because my children will go to the pantry multiple times during the day. So we have to be careful of the frequency that they're having these snacks, what type of snacks they are, and then what kind of drink they're following it up with. So water is always the best, milk is great, but being careful that you're not adding more sugars into the type of drink that they're having, especially soft drinks and even fruit juices that we think are healthy do have a high level of sugar that also creates cavities if taken too often. If a parent has concerns about their child's teeth, the first thing to do is go onto our website. From there, you can find multiple ways to contact our office, give us a call. That usually works the best. We're a very small office, so we always have someone monitoring those phone lines. Even if you think no one's here, someone will give you a call back. We have a messaging system to make sure that we do not miss anything. And then once you get here, the first thing we're going to do is get to know your kid. And that starts from the very second that you walk into the office. And so in our waiting room, parents are offered a drink or coffee. The kids can have a water as well. And from there, our staff will come up to the front, again, introduce themselves to the patient, and then we'll go to the back where we'll have the appointment. Your dentist will, I'll take a look, we can see what's needed, and if x-rays are indicated, then we'll kind of go through the process of explaining that and showing the patient what it involves and then taking any x-rays that might be necessary.